it's Dee, and I wanted to share with you today. I realized it's week 6. I had the cervical um, anterior um, disc replacement at C5, C6 to C7, so that's 2 levels. They cut through it here. Had it on March 16th. Um, I'm able to move my neck a little more. I still have numbness, tingling, and sort of like electrical shock. But it is normal. From what I was told, that the muscles and the nerves are still healing. But anyway, today I wanted to talk about, I was feeling a little energetic, antsy, I guess, because you're always resting, sitting around, walking, can't do much, right? But today I felt I'm able to move, clean, and I'm trying to move things back to where they should be. What I mean by that, it was because before surgery, I prepped a lot of things because knowing I live alone and I know that getting things to and from is maybe difficult. And so I wanted to share with you what I did and what you can take, what benefit you. First thing was I prepped a lot of water bottles and waters with Bendy straws. I don't know if you can see that Bendy straw there. I love it. It's a lifesaver because you're not able to tilt your head for a while. Well, it was hard. And when you drink, you kind of tilt your cup up, right? You won't be able to do that. So this is perfect. So I'm in the bathroom because I wanted to show you what they don't really tell you until you're at the hospital. And I wish they told you before, but I actually kind of thought about it ahead. What you need is 2 cups. I used, yes, these. You have one spit cup and 1 rinse cup, so you have 2. So one when you brush your teeth or what, you spit. You have another cup with clean water to, gargle with, whatever, and the other one to spit in. So, the PT nurses were quite surprised I already knew what to do. So anyway, you need 2 cups of that, 1 rinse and 1 spit cup. And to wash your face, I have, your face washcloth, because majority of us, we just want to rinse it over the sink, right? Excuse me, my allergies. So have a face washcloth, so you're just rinsing off from here, soap it down, then rinse it off. That's easy. The bathtub is the shower. I think they told you, I think from what I heard from everyone, it takes about no shower after 3 days. Technically, I just didn't want to wait till 3 days. So I did get a medical bath chair, but I have a small bathroom and that took up a lot of space, so that didn't work for me. I gave that away to another friend who is having a surgery, so anyway, that benefited me. I helped someone else. But in return, he gave me a plastic stool, and believe me, the stools are a lifesaver, because you're not able to raise your arm for a while. You can, but it's tender and it's tight at the same time after surgery. And of course, they don't want you to lift anything over. And so in the kitchen, where my cupboards are, my plates, dishes are everything up high. So I have let me reverse this. Not sure how to reverse it. But anyway, I guess I got to do it this way. I have two stools. See, this one is a collapsible one, so I could just port it around. It's light. If you can see that. So here. And then this one here I use in the bathtub. My friend gave this to me. This one's from Ikea. And it was perfect because I would put it into the tub and I would sit in it. And I have a bucket with just a little container. So if I were to shower, I would fill that bucket with water and kind of sponge bath myself. Here, I think I can capture that. So I got a blue skid mat so I don't slip, but this is what I'm talking about. This one's simple. I got it from Target. It's just so that because I didn't want this part wet, and shower, it was just like drop on your head, and then you don't want that wet. So that was my way of sort of sponge bath myself. If I don't want to sit on the stool, I sit on the tub, just be a kid again. And that's how I just kind of bathe myself. So that worked a lot. It was perfect because, I couldn't raise my arm. Yes, it was a challenge, you ladies. We have long hair. I used to have hair like up to here, but you know what? Temporary. I cut my hair short to here. Yes, I cut a lot. But hey, you know what? It'll grow back. So no harm. Temporary. So yes, these stools are a lifesaver. They help you carry, lift yourself up so you're not raising your arm too high. The other perfect thing to have is make sure, sorry, I'm trying to move this around, is it's going to be hard for you to like lean over to tie your shoes on when you have to walk daily. They suggest you to walk daily, so you don't have any blood clots. They want your blood to circulate, and obviously it does help you heal the more you walk around, right? So again, my friend from Ikea, what do you call this, that shoe horn? It's the one that you could, what do you call that? Help you slip your shoes on. Lifesaver. Such a lifesaver. So yes, get that. And it's pretty long, so it's like, how long is this? I don't know how to flip this phone. Sorry. It's about, kind of like my length of my leg. So it's perfect. So I just hang it on the doorknob and have it ready, and I have one of I got 3 slip-on shoes. Okay, I had one, but I bought 2 more because the fact that I won't be able to tie my shoes for a while. I think week 4 I was able to put my shoes on like regular shoelace. So anyways, that shoehorn was perfect. What else? Bendy straws. Yeah, so washing your hair, it may be a challenge. Just kind of, I don't know, I just kind of scrub a little here and there. I use a comb and So it's a little arm reach, and I just kind of do that. I don't know. It's temporary. Um, yeah, you're gonna need friends to help. I needed help to change my bed sheets. I just couldn't do it. Um, I have a friend that helped me with my laundry. It's quite difficult carrying, you know. I think week 3, pushing, yeah, sorry, week 3 grocery shopping. Difficult. I had to do, people don't realize, they can't see your injury, they don't know that you're in pain, so they just kind of ignore you, and so it's pretty hard. Doctor said I don't really need the soft brace, but I did use it, because it kind of gives a signal to other people like, hey, you're injured, right? So some of them are pretty like mindful, some they just like, oh shit. Oop. Anyway, some of them just kind of like disappear or give you a lot of space. But pushing the cart was hard. It hurt after, sometimes during my grocery shopping. I did have a few people, like, I would ask people to, hey, can you help me grab this for me or reach that for me? And I explained, like, hey, I just got out of surgery. Neck surgery. I just need your help. So there are people that are very kind. Even loading my car, sometimes they're like looking at me like, what are you talking about? And I just explained, like, hey, I just got a surgery. I need help. I can't lift this. And it's just a bottle, and it's heavy. What else? Oh, a heating pad. Perfect. I got one that could reach from my neck to my lower back. I think it's double X or triple X. I got it from Amazon. Oh gosh, lifesaver. That's gonna be your best friend too. I use a pillowcase and I just put it right over, because knowing that I'm gonna be on it often and I won't be able to, um, you know, the heating pad is washable, so I just didn't. Of course, like I said, laundry is hard, so it was just lighter, easier to just use a pillowcase and wash that and change it out, because I only got one heating pad, so didn't want to wait till that's over. So that is my lifesaver. Just make sure you have all your necessities out that you'll use daily. Another thing that I didn't know I needed, I actually called my neighbor and helped me. Like, hey, can you come and help me go into my medicine cabinet? And I could not reach. I couldn't look or anything. So I needed some of, like, make sure all your medicine's out. Like, things that you don't even think about. Like, I think I got heat rash from the neck brace, so I had to use. Oh, my friend. I literally called a friend and I said, "Hey, I can't drive. I need you to go to the store and get me the Benadryl. The pills that. Anyway, that's what my doctor told me to get. That went away. And the swelling or the redness. I was told to get cortisone, so make sure, if you want to, you don't have to. Cortisone, that helped. I also have, this is post surgery. Where did it go? I also got, I had this on hand. This Band-Aid here. What size is this? This is extra large. Let me say what size. Oh, 10. No. one 1 3/4 by 4 inches. So I just cut that in half, and then it fits perfectly right in the over the decision to cover from the sun, if you want to do that. Or what I did was I also got, where did I put it? Got this on Amazon. Gosh, what is it called? It's clear, and it's those that when you have tattoos and they have to cover it, waterproof. Oh, here we go. And these are like clear patches. So what I got was the gauze, cut it to size, like your incision. I actually cut this in half, and I create my own kind of band-aid. So I don't need the full. This is too big, but I use half of this, and that worked perfect because I have a pool. I got clearance that I could, start exercising in the pool. I'm not ready to stroke, like swim stroke. What I mean is I just go in and I just kind of, in the shallow, I kind of march and walk in place and kind of do like arm strokes. What do you call that? Just kind of like stroke around, like shoulder level. And so that's what I'm doing right now. But then I didn't want this. Actually, you can get it wet, but I just didn't want it in the sun because of my skin tone. It can get dark. So I'm just trying to prevent that. For now, it's still tender a little, and so that's why I still cover it. I don't know. And another tip that you should get, they're going to suggest you to get vitamin E, whatever vitamin E, but I already had this on hand, because there are times where, I cook and bake a lot and accidents happen. I burn myself in the oven, hitting the oven rack or whatever. But anyway, I already have this on hand. It's all natural. I like Derma E, Scar Gel. Can't really tell. Anyway, so I use that, but you can use vitamin E, so that's what, they suggest. But I didn't want to go out and grab that when I have that, so that's fine. I think that's pretty much it. I have plants, so I use, those sports water bottle. I just fill them up and just squeeze them when my plants need to be watered. But other than that, that's so far my tip. Pillows. Everyone's gonna suggest different type of pillows. I had tons of pillows from regular, hard, soft, density to, I think I have 3 different types of cervical pillows. They're all memory foam. You're gonna switch out a lot. I still struggle with that still, pre and post surgery. So just be patient. It's always gonna be a while. I'm sure a lot of you have massage guns. Be mindful. Wait. I wouldn't do it right away. Don't. I would wait maybe 4 weeks out. I just use it on my shoulder. Don't ever do it on your neck. Always, wait for your PT to massage you. But I just do it lightly, because my muscles were super tight, and but I have a TENS units. You can look that up. You can get that on Amazon. Never put it here. Always never put it on your spine in the back, just around on your muscles. Ask your PT. it's, it's because I've been in PT. I used to volunteer there, so I know what to do. So any medical things like that, like the massage gun and the TENS unit. Some of you said bone stimulator. Please always get the approval of your PT or doctors. It's because I already know how to use them, so I know what to do with it. So anyways, I wish you guys speed healing. Yes, it's scary. I had a lot of brain fogs because of anxiety and stress, but you know, I am I have no regrets. Yeah, it's a tough ride. Um yeah, I'm crying because it's like hard. I get it. I get it. Um so I just wanted to make this video to kind of give you guys, hey, pointers, you know, you're not alone. You got this. Um, Here to support you. And be well, speed healing, and you take care. Have a good day.